It is a time where we try to separate fact from fiction, especially when it comes to COVID-19. Dr. Ruth Berggren with the Long School of Medicine from UT Health San Antonio, an infectious disease specialist, joining us as she does most Thursdays. Doctor, thank you for joining us. You know, a lot of the discussion is about booster shots. Are they needed? When should we get them? Who should get them? Kind of break it down for us about where we are on booster shots and if they are necessary.
Okay, this is a really hot topic and we're all learning, and tomorrow is going to be an important day in this story. It is a fact that the Biden administration announced that boosters would be available to most Americans starting September 20th. It is also true that that announcement happened prior to the advisory committees, the vaccine advisory committees of the FDA and the CDC having their meetings and weighing in. So tomorrow what happens is there's a vaccine advisory committee for the FDA. It's an independent panel that's going to meet and review a lot of data, including data from Israel and data from Pfizer that shows how immunity begins to decline in the months following the vaccination. And they will take into consideration the dropping in the antibody levels, but also breakthrough infections. Something that's confusing to everybody and is causing some delay in consensus building is that we believe the breakthroughs are being driven by two factors. One is possibly declining immunity, but the other factor being the Delta variant, which seems to be more infectious. So after tomorrow, we'll have a little bit clearer idea of where people come down. And the following week, next week, there will be a meeting of the Advisory Committee on Immunization Practices from the CDC, and they will weigh in as well with specific recommendations about who exactly should get a booster dose. I can make a prediction, and I predict that there will be stronger recommendations for people over 65 and healthcare workers to get boosted, stronger than for kids that are teenagers or 12 and up. It's the younger you are, probably the less likely it is going to be a strong recommendation for boosting.
A question that we have from viewers is, what about when it comes to the flu shot? Would you be able to get that flu shot as well as the booster shot at the same time? Are there any risks associated with that?
Right. So actually, we really want everybody to get the flu shot. It's as important as ever. And you can get it on the same day. You can get, whether it's your first or your second or your booster COVID shot, you can get it at the same time and on the same day as your influenza vaccine. And the one thing to know is that you should get those two shots at least an inch apart from each other if you're having it on your arm, or in a completely different limb, meaning the other arm or your leg.
The monoclonal infusion center that's set up at the Freeman Coliseum, set up in many different communities, is that treatment okay for children?
So it is actually authorized for emergency use for 12 and up. They specify that children must be at least 40 kilograms. And it is not for just everybody. This is for people with symptomatic COVID who are at high risk of having a bad outcome. And in kids, that would really describe children with, say, sickle cell anemia, some kind of neurodevelopmental disorder, asthma, or lung disease, or people who are dependent on medical technical devices for their survival. But these are really important advances for everybody. And the data show that getting a monoclonal antibody infusion in the right time frame can decrease your risk of having to go to the hospital or die from COVID by about 70%. So it's a really important advance, and people need to be aware and not wait a long time before seeking help from a medical professional. These things are going to work best if it's within 7 days of when you got sick.
And lastly, we know about that Active 6 study. What are the ways that people can still get involved in that?
Active 6 is an opportunity for people to take medication in the outpatient setting. These are some pills that have been FDA approved already and have a long safety record, but they've been repurposed. And you can enroll in it without ever having to go to a clinic or a hospital. You just go online to www.active6study.org. That's activ6study.org. And you will learn more about it there. You do have to be 30 years old or older, and this is only for people who have a diagnosis of COVID that's been confirmed.
And this is a study that's taking place at UT Health San Antonio right now.
That's exactly correct. Thanks.
Yeah. Dr. Ruth Berggren, UT Health San Antonio Long School of Medicine, as always, appreciate your time.
Thank you.